Good morning, everybody. We are here with the Berea Chamber of Commerce at the Urgent Care Center here in Berea, Kentucky. This is just off exit 76 along I-75, and I'm going to scan around just so you can get an idea of where we're located. We're right here next to the hotels and motels. There is Fairfield Inn and Holiday Inn Express right there in the background. And of course, the interstate bridge and the exit ramps are over there. And the Central Kentucky Urgent Care Center here in Berea just opened here in Berea on July the 15th. So this is a new facility for us to have in Berea. And we're going to go in and take a tour today. So come along with us and go inside and meet everybody. And they're going to tell us about the services that they have to offer. So, good morning.
How are you?
Good. We're so excited to be here at the Berea Chamber of Commerce today and to have a tour and for you to get to tell us a little bit about Central Kentucky Urgent Care. So, lead the way. Tell us who you are and what you have to offer.
My name is Katie, and I've been a medical assistant since the beginning of Central Kentucky Urgent Care. Our original office is in Richmond, and we decided to offer a location here in Berea. So, we opened last week. We are open 7 days a week, 9 to 9. We offer a variety of services. Save you a trip for the ER when you can't get into your primary care doctor. From anything from rashes, cough, congestion, to lacerations. We do IV fluids. We can do outside labs, x-ray, pretty much anything. So if you're unsure, just give us a call.
Oh, that's exciting. So 7 days a week, 9 a.m. to 9 p.m.
Yes.
Wow. And very conveniently located here too, right off I-75.
Yeah, it's right off the exit. No real traffic, lights to go through, private parking lot. So easy in and easy out.
That's awesome. And you're also here, it's the single story, flat story, so easily accessible if you have mobility issues, things like that too.
Yeah, definitely. Just come right in. There's no stairs, anything, no difficulty getting into the room or anything like that.
Wonderful. And you're going to take us on a tour of the facility today too, right? So we get to see what all's here.
Right, kind of see what the place is like. So this is our lobby. So when you just come in, this is where you'll be waiting. And you won't wait long. Our goal always at Central Kentucky Urgent Care is to get you straight back to a room. Your wait is minimal, probably under a couple minutes after we get you checked in. Paperwork is not long, just the basics. We just want to get to the point and get you out and get you feeling better.
Oh, that's exciting.
So
nobody, when they're in emergency, they don't want to sit and wait in a waiting room.
You don't want to be here. We know this is the last place you want to be, so why be here? So, we will give you excellent care in the quickest time possible. This is where you'll check in, right here, and then, like I said, you'll be out in this lobby for just a few minutes, and we'll take you on back to our room.
So now I've checked in, I've done my process, and now I'm back into some of the rooms.
So actually, the first step will take you back to this first room, and we're going to triage you. So this is our triage room, just kind of where we take your blood pressure, get your weight, everything like that. See what's going on, and see where we kind of need to place you after that. So we have quite a few other patient rooms on here. And then...
Wow, everything is so clean and beautiful in here.
And bright.
And bright, yes.
Bright colors here. Right. So this one will make the kids' room, actually. We'll probably have a few toys in here.
Aw, look at all the extra colors, all the pastels. Isn't that cute?
Yes. And then
You're already getting thumbs up. I see reactions already, so that's great.
And I'll take you, and then here's the patient bathroom, and then we have a separate lab. And like I said, we can do outside lab orders there if you need, labs ordered that day. We have a separate lab in here. Here's where we keep all our medications, and we can do ortho-glass splinting. There's so many things we can do. And then we have a bigger room down here where if you needed IV fluids, x-rays or something, we would probably put you in this room. So.
And so that's always a exciting thing too to have available is the x-rays, because that's not something you can just go get at some of the urgent care centers. That's something sometimes you have to go more to the doctor or the hospital to be able to get.
Yeah, not all of them offer x-ray, but we do offer x-ray all the time. So we have 3 x-ray technicians, long-time x-ray technicians that have been on our staff, and they're great and wonderful. And we have the portable x-ray machine right out here in the hallway. And they can just move whatever room you're in. You don't even have to go anywhere and just get your x-ray in your room.
Oh, that's good too. Because if you have fell or if you've got something you think might be broken or damaged, you don't want to have to be moved around.
Yes, kids, and I'm telling you, it's sports season, and I've already contemplated the x-ray with my son this week. So,
well, talking about sports season too, do you all do physicals?
We do physicals. We do sports physicals. Our regular price is $25 for those, and like I said, very quick in and out and get you. But we're actually running a special till today. Anybody in Madison County, $10 sports physical. So if you need that last minute sports physical, come on in today and we will get it done for you.
Oh, wow. Wonderful. So now if they want to call you, how do they reach you? What's the phone number? Do they need to schedule or can they just walk in?
No, walk-ins always.
Always.
I mean, you know, we do some primary care with our Dr. Gimme Ray, but we could do scheduling with him, but walk-ins always. Like I said, quickest way, just get here. We'll get you registered, a little bit of paperwork. No big deal.
So the address here?
295 Paint Lake Road.
Okay.
And it's Berea. So it's right next to the Holiday Inn Express, right off the highway. The phone number is 859-353-8884. And we have since we have different locations, this is option 3.
Option 3
yes.
for Berea. Okay.
Yes, for Berea.
Wonderful. And so if somebody's watching this video and they happen to live somewhere else, though, what are your other 2 locations? They're both in Richmond, correct?
They are in Richmond, yes. Our original location is at 103 Keystone Drive in Berea. That's off exit 90, so the most north, I guess, from here. And then we have one off the exit 87, and that's 330 Eastern Bypass, and that's right by the Domino's and UPS store.
Okay. Good. Okay, well, we know where that's at then, too, because
Yeah.
we've heard from those and seen it on, when you call that number, they'll tell you those options, too. So
yes, definitely.
option 3 for Berea, though.
Yes.
All right. Well, tell us about some other things that you've got going on here. So are we going to get to meet the doctor?
We do. Our doctor, luckily, is not in the ER this morning, so we are lucky to have him here. So we will meet the doctor. This is our owner and our doctor, Dr. Gimme Ray.
Nice to meet you. And I hear that you go by Dr.
Gimme Ray.
Gimme Ray,
Yeah, yes.
and the staff here sometimes calls you BJ. Dr. BJ?
Yeah, Dr. BJ, you're right.
So nice to meet you this morning. So tell us a little bit about yourself.
I have been in Kentucky for since 2007. I've been serving the community of Kentucky since then. I was in Manchester for 13 years working as an ER physician myself. And I am an ER physician right now working in different hospitals, mainly at Middlesboro and Barberville, as well as in Prestonburg. I decided to open this urgent care type setup clinics to help the local community of Kentucky, residents, where they can be served within the community without going to the ER for simple cases like cough, cold, simple lacerations, and simple fractures that we can manage without crowding the emergency departments, and also helping the community in a timely manner so that they don't have to wait, and it is much better for them to be in a setup where it is close to their home. The second reason that I wanted to start this clinic was to serve those people who may not even have insurance, and may not have money to pay for the emergency room visit. So we do have 4 types of choices that they can afford, or if they have insurances or not. We do provide them at a certain low cost visit, which is $55, or at times we even do a $35 visit for them if they cannot afford it, and an all-inclusive like IV fluids and medications given within a $95 visit plan if they do not have insurance coverage for them. So if they have insurances, they can get them through their insurances. If they don't have it, they can use their own money and payment plan, whichever they want to do. So on that basis, we opened our clinic in Richmond first, and we have had a great response from the community, and we are so thankful for them that we got a chance to open a second location in Berea. Now we are trying to help the community over here, and we are so happy that I hope we'll get the same response that we have received from Richmond, and we are so thankful for the community to allow us to open this clinic and serve them.
Well, it's really exciting to have you here in Berea, and I know I'm smiling. You can't see me because I'm behind the camera, but I'm smiling because there's already comments and interactions on here. So people are loving the fact that you're here. We're already getting comments and interactions. And one is Chris Gilbert says, congrats on the new location.
Oh, thank you.
And
Thank you.
Angela asks, what are the type of conditions that can be treated here?
So we can the first thing I would like to say is we do not have any age limit. We do all ages from a month or 2 months of infant to any age group after that. So that is very important for anyone to know about. Because I myself being an ER physician, if somebody needs any kind of laceration sutured, if I'm free, I'm off call, and even I'm at home, they would call me, and if I can come and look at the lacerations or sutures that I can do, I would do it. If I can take care of a kid my own, if my nurse practitioners do want my assistance at that time. Though we do have nurse practitioners who are almost all of them are ER experienced nurse practitioners, so I'm very proud of them, and they do provide excellent services to all the age groups. So that is one thing. And we do provide IV lines, IV food fluids, sometimes even IV antibiotics. We have had cases where they have come for 2-3 days of antibiotics, given in the clinic at times, if they do not have money to afford to go to an ER visit or to be admitted in the hospital. So those things are there. Simple things like common cold, headaches, and simple fractures, those things we manage. Fever, other things to mention about, sutures, suture removals, those things we do it. We do x-rays here, so it is easy for them as long as possible. We do have a fixed x-ray setup at Richmond Clinic, so that also offers them a good x-ray panel to follow up with. At times we have also done, with the help of our hospital setup, we do call the hospitals and have them get CT scans done for our patients as a follow-up for them, so that they don't have to go to the ER. They can just directly go to the hospital and get x-ray CT scans done if it's needed. Some patients don't want to get to go through the ER, especially when it's so crowded at both places, Berea and Richmond. So they do want X-rays, CT scans to be done. In those kind of cases, we have called the hospitals, made arrangements for them to get CT scans done at the hospital setup, and we get the results back, and patients have been satisfied with that.
You can tell you have such a heart for serving the people here in Kentucky. That is amazing. And even we have another comment from Pauline, and she said, this is amazing for the Berea community. So congratulations, and thank you for all that you are offering. So those of you that are watching this live, feel free to ask some questions, make your comments. I can get to those and ask the doctor while we're here. If it's after we're finished with our Facebook Live, we can reach out to Central Kentucky Urgent Care and ask them, and we can make those answers available to you online too. So please feel free to interact and comment too. And you are just such an asset to Berea. So we just want to say thank you for offering this and being available here.
Thank you for making us a part of your community and helping us to serve the community, for as long as possible. Thank you so much. I love Kentucky. Thank
you.
With Dr. Gammy also, and working for him for going into 5 years now. We do have school supplies here. He does this every year for the community in Richmond, and since we're here in Berea, anybody that needs school supplies, we have notebooks, rulers, stuff up here. He always does this for the children every year. So he definitely loves his community, and he definitely wants to give back. So that's here for you guys too, if you want to stop in and see the building and stuff. A list of services, so you can follow us on Facebook also. We have lists, we have flyers, and we're trying to get flyers out to the community really this week a lot. So.
And we're counting on those of you that are watching this Facebook Live through the Berea Chamber of Commerce to help the community know, because like we said, they just opened July 15th, 2021. So that was just last week. So they've only been open here in Berea for a week. So people don't really know that this is available now.
Right.
So we're counting on you guys to share, to comment, and to get this information out to everybody.
Definitely. Anyone you can tell or share, definitely.
Wonderful. So I see a couple more faces in here. Are we going to get to introduce some of the other staff?
Yeah, this is our office administrator. This is Jean.
Hi, Jean. How are you doing?
Hello, Gene Ferguson. Yes, I'm the office administrator. And thank you all for joining us this morning at Central Kentucky Urgent Care Center.
So tell us about some of the fun things you get to do on a daily basis.
Well, I kind of stay in the background and, look at the billing and those types of things. And along those lines, we do accept quite a few insurances, most major insurances. We accept Medicare, Medicaid, the Medicaid MCOs, if you have those, Anthem, Humana. And of course, you can just give us a call to learn if we do accept your insurance.
And what was that phone number again if they need to call?
Yes, the phone number is 859-353-8884. And for the Berea location, it's option 3.
So when you get on that phone call, hold on for just a second and then press option number 3 to access the Berea location.
That's correct.
Wonderful. Well, Jean, it's great to meet you this morning. Thank you for being on Facebook Live today.
Great to meet you all. Thank you.
And there's another face over here, so.
This is Michelle. This is our nurse manager.
Well, hello, Michelle. So tell us a little bit about yourself.
Well, I've been here for a little over a year, and I was able to meet Dr. Guinea working in the ER and took this position. And I do a variety of things, anywhere from scheduling, if they need me to go see a patient, triage, just a little bit of everything. It's a good experience.
That's wonderful.
Yeah.
You can tell that there's such a wonderful team feel in here in this office. Everybody just, gets along so well and just loves each other. You can tell that you guys love your jobs too.
We do, yeah. It all depends on the environment and the boss and that. And like I said, I've been with Dr. Guinea for almost 5 years now, and it definitely is a family environment. If anybody needs anything, we have a constant text thread between all of us. And so, if it's just simply wishing happy 4th of July or a birthday or anything, everybody is always family oriented here. So,
By the way, I did not mention about if somebody needs a primary care providers. We do primary care providers sometimes because I'm a primary care provider myself, but I've been always working in the ER. So sometimes they do not have insurances and follow-up is a problem. So we do that too, depending on the case-based. I do see patients. Obviously, I'm working in different ER, so there's less of a time, but as much as possible, I do give my time. I meant this to be a service for the community, and especially I have an autistic son, a 16-year-old autistic son. So if anything I can do for the community in the developmentally disabled kids, autistic kids, or any type of disabled kids, that would be my goal in future, to sustain this clinic and help in that regards. Whatever we can do in that manner, that is the main reason. I would like to in the future concentrate everything with the school and the university system based on those kids that are disabled, and we would see what we can do for them to provide an option to work, an option to be useful for the community in whatever manner we can do. So I think that would be my ultimate goal of starting this clinic and sustaining it and running it. Otherwise, that is my main thing of starting this.
It's always so wonderful to see such investment back into the community, especially when you're here. And so in Madison County with the 3 different locations, and especially here in Berea, to be able to just be here to serve the community and give back, where especially like you said, where it's a place that just touches your own heart as well.
That's true. You mentioned about 3 different locations. Our first location is at 103 Keystone Drive. The second one is at 330 Eastern Bypass, which is in a conversion phase of us trying to start Botox clinic and something like a facial aesthetic types, because our nurse practitioners were desiring to have that set up in the clinic. So I'm trying to convert it into both a telemedicine with urgent care and aesthetics for facial aesthetics clinic at Eastern Bypass location in Richmond. And we have moved that urgent care portion mostly to Berea now, so that we can serve the Berea population better. And
Wonderful. That is wonderful to hear. So it's great to know all the different services that you have available and where to find those.
oh yes, the aesthetic clinic will be starting in August 15 to 16. Our time frame is we are trying to get it started since then, from August 16.
So if you're watching this video after August of 2021, just know that that's likely going to be available at the Richmond Bypass location. So
yes, it's something that I think with the help of our nurse practitioners and some of the staffs, we want to start it and see how it goes.
Wonderful. Well, thank you so much, Doctor. We appreciate that and appreciate the different services that you have to offer and the staff this morning. I'm going to scan around again so you can say hi to everybody.
Thank you for giving us the
Good morning.
time.
Thank you.
Oh, we appreciate it. And thank you for joining the Berea Chamber of Commerce. We greatly
you so much.
appreciate that.
Thank
We get phone calls a lot, Katie, that, people ask the chamber. People don't think about that, but people will call the chamber or email the chamber and ask, where do I find this service? Or how do I find this particular business? And people don't realize the importance of a chamber, but you being a member of the chamber helps get this information out to everybody. So we just want to say thank you for joining.
I've been so excited since I spoke with you the other week. Yeah, when just even looking at your website, I knew it was a good step. So yeah, definitely. But anyone that has any questions, feel free to call today. I'll be answering the phones. It's 859-353-8884, and it's option 3. And we offer more services than we don't. So pretty much you'll probably be able to be served here. So just give us a call.
Wonderful. Well, I'm going to scan around and get Jean in the photo one more time and maybe some of those school supplies. And Jean, say hi to everybody.
Hello.
And I'm going to get all of you together if you don't mind. Can everybody stand together for a second? And so this is the team that's here this morning. So everybody can say hi. And we want to say thank you to Central Kentucky Urgent Care Center for joining the Berea Chamber of Commerce, for being a member of this community, for giving back to the community, and also for letting us come in this morning. We're so excited because, like I said, they've only been open about a week. So we're literally in this location as they just opened to do the tour. So we hope that you'll get this information out to everybody, share that information, comment, ask questions, and stop by and see them when the emergency or when something arises, or, if you need some follow-up appointments too. So call ahead if you have some questions. And thank everybody. Thank you so much for being here this morning. And thank you so much from the Berea Chamber of Commerce. Have a great day, everybody.